Welcome to this edition of Go Vote Omaha, presented by the League of Women Voters of Greater Omaha. The League of Women Voters is a nonpartisan organization and does not endorse political candidates or parties. The League does, however, take positions on issues, and our purpose is to empower voters and defend democracy. Go Vote Omaha primarily focuses on policy issues, and as a result of our discussions, we hope you'll feel ready to make informed decisions at election time. I'm Cindy Maxwell-Osteik, member of the League of Women Voters of Greater Omaha, and your host for today's program. Today we're talking to our friends from the Protect Our Rights campaign about their ballot initiatives and the barriers faced by all Nebraskans finding reproductive care. Joining us today is campaign manager of Protect Our Rights, Allie Berry, and Dr. Sophia Jawed-Wessel, associate professor of public health at University of Nebraska at Omaha, and member of the board of directors for Nebraska Abortion Resources. Thank you both for being here.
Thank you for having us.
To begin, could you please tell us about Protect Our Rights and what is the work that you do?
Yeah, so Protect Our Rights is a ballot initiative. So we're trying to get the fundamental right to abortion in the Nebraska Constitution. And I am Allie Berry, and I'm the campaign manager for the campaign.
Wonderful. And how did Protect Our Rights get started? What are some of the successes the organization has experienced and some of the things you've learned from the inception?
Yeah, so we came together in November of last year, a coalition of organizations that are working in the reproductive justice space here in Nebraska. So something that we're proud of course, is getting our ballot together, getting the initiative, getting it off the ground. And since launching in November, we're really proud of all the signatures that we've collected so far, and also just the work that we've done in the communities, educating people about the importance of protecting abortion in Nebraska.
Absolutely. You guys are in the busy season of collecting signatures for your ballot initiative. What's the process for bringing an issue to the people in the second house here in Nebraska? Getting it on the ballot, are there any barriers or misinformation that you'd like to address?
So Nebraska is actually pretty interesting. We have a robust way that people can have direct impact on the policies that are shaping their lives. So there's a ballot initiative process. What we are specifically trying to do is get a constitutional amendment in the Nebraska Constitution. And what that means, the first step is we have to collect signatures from 10% of the voting population, which is about 123,000 people. And made up of that, we also have to get 5% from 38 of the 93 counties. So we have to go out, collect the signatures, and then we'll turn them in but by July 3rd. That's our deadline. And then from there, it will be on the November ballot for people to vote. Basically, a vote for will, add this to the Constitution. A vote against will not add it to the Constitution. And the reason we wanted to do a constitutional amendment is just the importance of protecting abortion. Not worrying each legislative session if there's going to be laws passed by legislators that will further ban abortion. So that's the importance of actually doing a constitutional amendment and giving the people the power to decide, these important healthcare decisions that we believe should be between the patient and their provider. On the misinformation piece, there are definitely a lot of petitions out there, so I think there's been a little confusion, but the most important thing to know with our petition is that, if you're signing with us, they'll have our logo somewhere on them, maybe a t-shirt like this, a clipboard that has our logo, just basically their logo anywhere on them is a first sign. But the most important thing you want to look for when you're going to sign a petition, make sure that it says the fundamental right to abortion. In the object language, which is up here at the top, you'll see on the petition, it's really important because there's a lot of petitions going on, and if you want to protect the fundamental right to abortion in Nebraska, the Protect Our Rights ballot initiative is the one you want to be signing.
Very good, very good. What impact does accessible reproductive health care have on our community? And it's not just about pregnancy. Where does it go beyond that?
It's a great question. Yes, it goes well beyond pregnancy. My specific area of research and study as a professor is in sexual and reproductive health. And one of the reasons I've chosen this line of work and that specific area is because of how access to reproductive health care, the full spectrum of services, impacts in a ripple manner so many people. We have decades and decades of science that shows that when somebody, especially somebody who has the ability to get pregnant, has access to that full spectrum of services easily and in an affordable way, We see benefits like higher educational attainment, better and more consistent involvement in the workforce, higher income, and these economic related variables don't just benefit her, but they benefit her current and future children. And when families like that benefit economically, the entire community starts to flourish. So that economic piece is really important. When we look at abortion, specifically access to abortion, one of the really profound impacts that we've seen in the last several years, especially as access has kind of turned back a bit, is that maternal mortality significantly decreases when there's access to abortion care. So in 2020, there was a pretty large-scale study that was done, and it found that maternal mortality increased by 62% in states that had abortion restrictions. And that's a massive jump, especially when you think about how maternal mortality is already much too high in the United States. And when we think about who it impacts, maternal mortality is not something that is experienced evenly across the board. We see Black women especially who are particularly vulnerable. So we're talking about how, access to these services is going to help all communities, but especially bring up those who are already vulnerable for negative health outcomes.
It's such an important thing that we're talking about in this infrastructure, the stigma, the myths, uneducation. They're large barriers to understanding and compassion. How might people voice their experiences and possible barriers to reproductive health care and involve themselves possibly in these efforts?
That's a great question too. As a research scientist, I'm a little bit biased here, but I think getting involved in actual research is a great way to share your voice in a way that's protected and private. We're going to be launching some studies this summer that are specific for people in Nebraska or those who are seeking abortion care in Nebraska, where they get to share the barriers that they're experiencing. And because we want to know what is the experience of accessing abortion care for our region. That's something that hasn't been done before. So that's one way to share your experiences and the barriers and facilitators that they experienced along the way. We always welcome people to share their stories around abortion, but that can be hard to do because, like you said, stigma. But the more people that we see, have had experiences with abortion or have thought about having an abortion, the more we can see that this is an experience that is really widespread. And we see that all the reasons people have for having an abortion don't actually matter because there's so many different types of reasons. There's so many reasons that go into a decision that is made about your reproductive health. And that bit is really important to me for us to recognize that there's so much variation. And that's motivation for me to continue to fight for people's right to have that access.
Wonderful.
Yeah, and I think on the campaign side too, definitely sharing those stories. Those are really impactful, and for voters hearing it directly from Nebraskans, especially stories with the current 12-week ban that was passed. So we're actually coming up here on the 22nd of last year of May is when that was passed. So Nebraskans have been living for almost a year with this 12-week ban and the rippling effects of that. So we're always looking for people who are willing and able to share their stories. Those are really impactful. And then I think on our end too, through the stigmatization of it, we're not shying away from saying abortion. You'll see it on our boards. It's in our it's in our language. We're not afraid to say that word to kind of help with that, the stigmatization of it. And it's something we're proud of and don't want to shy away from.
Well, and it's healthcare.
Exactly.
We just really need to make sure and help people feel comfortable and making sure that they understand that this is our healthcare. When these initiatives come out, there's a lot of focus on metropolitan areas. How does that translate to the rural parts of the state, and how do we make sure that rural Nebraskans are informed and involved?
Yeah, it's a great question. I think one of the big things we're doing is just trying to make sure we're engaged everywhere in the state and really working with the amazing people that are already, in the communities, connecting with them, leveraging, the power and the information they have there, especially as we're going out and talking about this topic. Talking to the people who actually live and work in those areas and know how to talk to their community. So that's huge. And just making sure we have a reach, whether it's we're having road trips where we're trying to bring people kind of from the Omaha and Lincoln area out to talk to people in other areas. Like I said, working with the local community leaders to host events and just make sure, I think, the benefit of social media and everything we have these days, you can really increase your reach, but you have to physically sign the petition. So just making sure we have volunteers and staff, throughout the state to give people the opportunity to sign. Actually today, what I was working on a lot was some amazing volunteers that reached out directly to us that wanted to host, signing events in their communities. So I just got done working on the logistics for like 5 new signing events that are gonna be kind of outside of the Omaha and Lincoln area. So we're super excited about that.
Like where?
Yeah.
And what kinds of areas?
So we're gonna have Fremont, O'Neill, Atkinson, Chadron we're going to have they're going to do signing events every Friday in the rest of June. So really, and a lot of those, it's been really cool. Those have just been volunteers that have reached out that are really passionate and really think that, the right to abortion should be fundamental and also just a decision that should only be made between a patient and their medical provider. And they're willing to come along in the fight with us and help us get those signatures. Because like I said, we do have to also get 5% in 38 of the counties.
Well, and I know I wanted to also ask you about how ways people could get more involved with the larger conversation when we talk about reproductive health care.
There's so many different ways. So we mentioned telling stories, sharing that doesn't have to be in a big public scenario. I think just talking to your friends about your perspective on the campaign, where you fall on this, why abortion is important to you. Those interpersonal conversations that happen can be really impactful, and that's actually something that research shows as well, that we are moved by and learn when we have these one-on-one conversations with one another. And then there's really wonderful organizations that are doing work in this area too, such as Women's Fund of Omaha, of course Planned Parenthood, IB Black Girl, and we're near Nebraska Abortion Resources. We're always looking for volunteers to come get involved, and that doesn't have to include sharing your personal stories. That can just be being part of the movement with us.
Well, and as far as ways, I'm so sorry, I was going to misword this next question. What are examples of simple policy or language changes that have or could have a big impact on people facing reproductive decisions?
So I think if anybody has been following the different laws that are popping up from state to state, now that they are able to create these laws, we're seeing a lot of variability in that language, and it's confusing a lot of individuals, but the language itself is purposefully confusing. When we use words like conception, that a lot of these laws include, so when they say something like 6 weeks from conception, that's actually pretty vague because conception is not a medical term. It's a medical professional would use something like fertilization, implantation. Conception is not going to be in a medical textbook, right? So that creates confusion about what does that actually mean. So, and who that hurts the most is going to be that pregnant person. So if somebody's experiencing a miscarriage or goes into the hospital for care and needs an abortion at that point, trying to sit down and figure out what that law means could harm her health, right? And we're seeing that this is happening. There's also other policy things around even just 6 weeks gestation. So is that since the last menstrual period? Is that from an ultrasound? How are we dating 6 weeks versus 8 weeks versus 7 weeks? What does this language even mean? Those little changes have great impact on how that law is implemented. And at least it's my opinion that they're purposefully vague to create confusion, to create fear, and to keep medical health providers from being able to feel confident in giving care to somebody because they don't want to have their licenses taken away, right?
Well, yes, and how about what we've seen with impact on IVF?
Mm-hmm.
How can you tell us? I know there's a lot of confusion about that too.
So the broad, confusion around here is, okay, so the big picture, okay, I'm gonna go like as big as I can here is, if somebody doesn't have access to abortion, if they don't have control over this, right? Okay, what does that mean for a fertilized egg, an embryo that is in cryo, that is frozen, right? How is that different from what is happening in somebody's uterus, right? So if we're not allowed to, have an abortion, why is it that we can destroy a frozen embryo? And so because of this logic, people are going after IVF as well, because the debate is being shifted from who gets to decide about what happens with somebody's body, a pregnant person's body. Is it the pregnant person and her medical provider that are having this conversation, or is it the government? To when does life begin, which is something that cannot be answered via policy.
Yeah, and I think too, the purpose behind the language of our petition is really to put that decision back with the patient and the provider and make the language really clear. And we're really clear in our petition. So basically, it's the fundamental right to abortion without interference from the state or its political subdivisions up until fetal viability. And we actually define that as the point in pregnancy when, in the professional judgment of the patient's healthcare practitioner, there's significant likelihood of the fetus's sustained survival outside the uterus without the application of extraordinary medical measures, or when needed to protect the life or health of a pregnant patient. So it's very clear, and we define fetal viability in there because we want it to be clear and just know that this was all created with medical professionals because at the end of the day, we really do believe that these decisions are deeply personal and they should be handled with privacy and compassion with a patient and their medical provider. And there's no room and no need for government to be involved in that decision whatsoever.
And pregnancy is so variable. It's so individual that having a large policy that bans access to a health care that's related to pregnancy, people are going to fall through the cracks all over the place.
What is next for Protect Our Rights, and what are you working on right now?
Yeah, so right now we're just out getting the signatures, getting those 123,000 signatures we need. So if people that are watching haven't signed yet, now is really the time. So we have until July 3rd, and then after that we'll turn them in, and then after that, we'll turn around and engage people and get them, to vote for this. So that'll be the next step that we're working on.
Getting ready for November.
Yeah, getting ready for November. And then just educating people, about the language and what a vote for this means. And, the whole process is a little, with the ballot initiatives, a little complicated, even like the wording of voting for it. So just doing the education around that and what it means to vote for this and, the impact it'll have on Nebraskans when it passes, when people, get their healthcare decisions back.
We have some exciting programming and advocacy efforts coming up. How do people get involved in the work you do, and what would that look like if we could help?
For students at UNO, I would love for the people who are interested in sexual and reproductive health to consider participating, volunteering for my lab, SOLI. We do research in a wide variety of areas surrounding sexual and reproductive health and gender as well. And then here we have our fundraiser is still happening, and we love to have volunteers go to our events and promote access to abortion via NEAR, who 100% will support logistic. Here, I'm stumbling through my words.
That's okay.
Excuse me. As of right now, we are 100% supporting financially anyone who calls in who is living in Nebraska or seeking care in Nebraska for abortion care. And we'd love to continue that pattern via our fundraising program.
Very good. I'm so glad that you're able to share about that. Thank you. And we wanted to make sure and thank you for joining our program today and speaking with us, Allie and Sophia. And for the League of Women Voters of Greater Omaha, I'm Cindy Maxwell-Osteik, and I wanted to remind you to inform yourself about issues and candidates and make sure and follow Go Vote Omaha.